Hello everyone, welcome back to What's for Dinner. It's about 4:45 on, what's today, Teresa, Thursday? Thursday, yeah. We've been out of the loop for a few days.
Yeah.
Spent a few days with some friends out in the country, went on, did a little floating on the river.
Did a little back road driving.
Did a lot of back road driving, was a great time. Had to recharge the batteries and just kind of relax a little bit, but we're back going today. We were at work, so what do we have going on for dinner tonight, Teresa?
Okay, so the usual. It's just the usual.
Oh yeah, so we got bacon from our well-loved air fryer, the Instant Vortex Pro. And this air fried bacon, if you guys have not tried it, I highly recommend it. It's incredibly crispy and it's almost melt in your mouth.
Especially fresh.
Especially fresh. And then we've got some eggs going.
Yep. So I let these the whites get white, and then I stir it. And so I call it coarsely scrambled because I don't like the whites. So then that way you still have the yolks and it's just scrambled together. I can eat the whole thing.
Yeah, it's good. Good that way.
Yeah.
All right. And then you're doing steaks today in the skillet?
Yep.
Yum. Right on. Put a little seasoning on those and a lot of butter.
A lot of butter. Hopefully it's well done enough for you. Not that you like it well done, but.
Yeah, gotcha. Well, kind of medium. And then for those of you who are curious, so for seasonings, Teresa loves the Redmond's Real Salt, and I like the Jane's Crazy Mixed Up Salt. And then we also have, oh, you didn't put it out today?
What?
I was going to say we had the carnivore rub that we put on it, but that's okay. We won't talk about that
chili
today.
lime.
Yeah, we have a chili lime flavored rub that we put on it as well. So, but that's not out today. So will any of this stuff that we put together tonight cause our blood sugar or insulin to rise? And if so, why is that important?
It will not. And it's important because the last couple of weeks I have diagnosed a lot of non-alcoholic fatty liver with normal liver enzymes. So a couple are out of the range high, but I want your ALT and your AST below 20. And so you can see that things are happening even if they're normal. So you can have elevated, trying to think of what the numbers were, but elevated if your ALT is bigger than your AST and both are, at the upper end of the range, or elevated, that's non-alcoholic fatty liver. If your AST is better than or greater than your ALT, that's some sort of hepatic toxicity or drug-induced liver issues, but it's a big deal. So none of this is going to cause fatty liver, except what some of the vegan propaganda doctors want to tell you is meat and fat cause fatty liver. It is alcohol and it is sugar.
So the exact opposite of what they're saying.
Yeah.
Yeah, gotcha. So if somebody drinks alcohol on a regular basis and they want to know if they're getting fatty liver from their alcohol, will the ALT and the AST, will those both also measure the same? Is it the same for them too?
Yeah. But if you so I do that under a CMP, a comprehensive metabolic panel. It's your glucose, electrolytes, kidney, and liver. If they're normal, your provider says everything is normal. They don't say anything is abnormal until it gets out of range. The end. Most of them. I mean, there's some good ones that are outliers, but you can see things happening. That's what we're trying to do. See things happening. Before your A1C, which is your diabetic marker in corporate medicine, gets out of range to say you have diabetes, you can see it coming if you're looking and prevent it.
Okay. So we're talking about metabolic health here and stuff, but I don't know if some people may not know, Teresa, that you actually do hormones too,
Yes.
And that was your first love. So we wanted to kind of talk a little bit tonight about how whoa, careful over there. How the hormones and metabolic health, how they kind of work together and play nice together. Because the way the practice has gone is you started off in hormones, and over a period of time you kind of I just say the natural progression of things led you into metabolic health as well.
Yes.
So talk about that.
So I had to fix my crazy self, and I was a hot mess. And as soon as I did, then I could start, and I was 42 when I started hormones. I started progesterone and testosterone, and then I'm on thyroid for thyroid disorders. But then I could concentrate and fix the rest of the stuff that needs to be fixed. So you can think about food. If I had gone to the person I went to in Florida and got my hormones, and he said, you don't need hormones, you just need to eat salmon and broccoli, I would have probably cut him. Because how am I going to eat salmon and broccoli when I can't even get it together?
Yeah. So what you're essentially saying is that, getting people on hormones, it gives them the motivation, the drive, and the ability to actually start implementing those changes, because that's what they're lacking is the hormones. And some people would argue, though, they come to you and they'd say, well, I want to fix my hormones naturally. I want to start eating a different way, and I want to start doing, oh, don't roll your eyes over there. I mean, come on, it's legit. But what they don't understand is what you're trying to do is hormone optimization. Like
The people that are saying that are the people online, because I keep seeing this, because they probably hear us talking on Facebook Live. The people that are saying that online are the providers that are not allowed to prescribe medicine. So they're saying eat foods. If your ovaries are gone, okay, you've had a hysterectomy, or my ovaries sent their resignation letter in 3 years ago. If your ovaries are done, it doesn't matter how much food you eat. It may help with hot flashes and night sweats, but it's not going to fix all of the age-related and health-related diseases that come with not having hormones. For instance, today I talked to a woman who was my patient a long time ago, like 2015, 16, and she wants back on. She went off her hormones, figured out that they were helping her. She became apathetic, a little bit of weight gain, hip pain, that kind of thing, and vaginal dryness, painful sex. So she went to her GYN, who's never prescribed her hormones. It was me and then somebody else. And her GYN said, oh no, you can never go back on hormones once you've gone off of them. And I was like, what? And then I actually said to her, I said, we got to move on because I just got done with a staycation and I'm feeling pretty good. So, but you absolutely can. That doctor, first of all, is quoting the Women's Health Initiative, which is pregnant horse pea, estrogen, and Provera. We don't use these. I don't recommend you using these, but you can't be on those for more than 5 years is the position statement. That's wrong. You can be on pregnant horse pea as long as you want, as long as you started it at menopause, okay? This patient's 63 now. So she said to my patient, you don't need hormones, but since you don't have any symptoms of estrogen and progesterone deficiencies, but since you're having low libido and painful sex, I'll give you testosterone. So my response naturally was, well, did she do labs to make sure that your estrogen and progesterone level is good? No. Did she do a DEXA scan to see if you're having bone loss because you have no estrogen? No. So how does she know you're having no symptoms? Because estrogen protects you against colon cancer, dizziness and imbalance, heart disease, Alzheimer's and dementia, bone. I mean, come on. What do you have to say with all that?
So all that is to say is that, when you first get, when new patients come to the office and stuff, as far as the metabolic health side, we still help, but we're not withholding information. We still give them tiny, no pun intended, but bite-sized pieces of information for them to start with. But the initial go-to for you is hormones.
Yeah.
And you get people feeling better on the hormones, and then we start taking those larger steps. We go from crawl, walk, run kind of, if you will.
Unless someone comes back as a diabetic or pre-diabetic, I'm like, we don't have time to wait. We don't have time to become a not hot, crazy mess. You got to start thinking about it, which is why I hope this page in YouTube is helpful, because it's like, okay, well, now what do? Just go watch our videos. And you can always be 3 days behind us. So tonight we're having this, so you plan this for Saturday night and you're ready to go. You know what I'm saying?
Yeah, that makes total sense.
The other thing I want to say about hormones is we're not looking for normal. So any lab that I do, even on myself, when my labs were first done, and I was 42 at the time, I'm 53 now, my progesterone was less than 0.5, because that's 0, and my testosterone was less than 0.2. Okay, that's 0. Remember from 3rd grade, you can't round either of those numbers up, they got to go down. It comes out as normal. On the lab ranges, it's completely normal. Well, no thanks.
Yeah, so, to put that in context, like from a guy's standpoint, if you're 75 years old, you're within normal limits for you is going to be 0 on your testosterone, but you're also going to feel like crap because of that. So what do you do for a guy like that who comes in who's 75 years old?
Give him testosterone.
Right. And what kind of levels are you looking for? And what kind of outcomes, I guess?
I want him to be motivated, get up and mow the lawn, not fall asleep in a recliner, have good muscle strength, want to go to the gym, good recovery, blood pressure better, mental clarity, and then of course libido.
Yeah, absolutely.
So
just because, that's normal for it doesn't mean you have to suffer from the symptoms that you get as a result of that, right?
I don't want to walk around like a 75-year-old with osteoporosis. He's on a ton of meds. He's not getting erections. He's not having sex. Like, no thanks. 75, maybe 85, maybe like, oh, that's good genetics. That's good. You're living a long time. Well, no thanks.
Leanne Snyder just came on and says, I have never felt better at 56 and
Yay!
she put me on hormones.
Yay! So, Yay!
There's a living testament right there.
Thank
you so much, Leanne.
Yeah. It's such a big deal and your providers are missing it. And so this woman said, why would my GYN say that? Because your GYN doesn't learn hormones. Yeah. They're a GYN, but they don't learn hormones. Nurse practitioners, we don't learn it.
Yeah, and you got to also understand is, we have this insurance-based model that we're, that the Western medicine that here in the United States where the providers are working with, and it literally allows them for 15 total minutes to work on you as a patient. When I say 15 minutes, I don't mean 15 minutes with you. I mean, that means working on you. So we were having this conversation on the ride home from work tonight, and they've got about 5 minutes to spend with you face to face, about 5 minutes working on prescriptions, and about 5 minutes of charting for about a total of 15 minutes. And that's all they can do, because if anything beyond that, they're losing money. They don't get reimbursed enough on their insurance, and they've got to see volume to make up for how little the reimbursements by insurance companies are.
When I was in the insurance model, which is just part-time and for a short time, I never got my charting done in a day. Like, you had to keep moving, and I just would keep notes and I would chart after the fact. But and there was studies a doctor did, because suicide rate is highest among physicians. And so why is that? Because they're burned out by the 11th patient. Okay, the 11th patient is probably at 9:30 in the morning. Okay, so So
it's like the McDonald's of healthcare. You just gotta ram people through, and the bad thing, that's fast food, but you don't even get to choose your fast food. The doctor's choosing for you, or the provider is.
Yeah.
They're telling you what you need. They're
Nate,
just
you want to come say hi?
Just following the algorithms and stuff. So
Nate's up here, but he doesn't want to say hi.
that's all right. We're at 11 minutes anyway, so we're kind of up there on our time. But
sorry.
Did you have anything else you wanted to? Okay, guys. Well, thanks so much for watching. We love you all, and tell us what you're having for dinner, and we'll see you next time. God bless everybody.
Bye.